Health Minister Dr. The Honorable Dwayne Sands says the push to have persons vaccinated continues in light of a recently imported case of measles. Officials are monitoring the global measles epidemic that has seen thousands infected. Speaking to reporters, Dr. Sands said the plan remains to get as many people vaccinated for the disease as possible. He outlined where health officials are on the vaccination numbers.
We have continued with our catch-up program. We intended to get as many as 30,000 persons additional vaccinated. At last update, I believe we've gotten about 10,000 of them vaccinated. But there are teams at the airport, there are teams at a number of places specifically because it's impossible to tell.
Health Minister Dr. Dwayne Sands speaking to the country's efforts to protect residents and prevent any possible measles outbreak. Measles is a contagious respiratory infection that can cause a total body skin rash and flu-like symptoms. It typically affects children under 5 years. Dr. Sands says there are those that remain resistant to vaccination.
The anti-vaccination movement has created a big problem with a disease that is preventable. And to have 140,000 people die from a preventable disease is unacceptable. The Bahamas has about a 85 to 90% coverage rate for measles, and we want to get that up to 95%, certainly by the middle of next year.
Many of the people who contract measles have not been vaccinated. The vaccine comprises 1 or 2 doses of the MMR.
The thing is to make sure that we are immunized. And so because it becomes an issue of international best practices, certainly the idea for yellow fever and other really dreadful communicable diseases that vaccination is necessary, we would be guided by the Pan American Health Organization, the World Health Organization, about what international policy would be appropriate. But we can certainly see to it that our people are protected. And so I say to you that if you haven't been vaccinated or you're not sure, then get a top-up.
He was also questioned about a case that appeared in the headlines that suggested that a child died after being vaccinated. The health minister clarified what happened with that case while admitting rare cases can occur, but ultimately he says vaccinations are safe.
I believe that the story, as I understand it, is that a young child, having gotten a vaccine containing 6 different antigens for 6 different diseases, then developed a very rare response, and in the course of treatment ultimately developed a cancer and died. Let me be very clear, vaccination is safe. Family is obviously distressed. They have lost a lovely child, and we look at these situations to learn and to improve.